And thank you for staying up late with us for another edition of the Factor Uncensored. We want to thank you for joining us. Tonight, we are talking about problems impacting society through life and death. We start off talking about an issue that is disproportionately impacting young women. According to the United Nations, young women are more than twice as likely to contract HIV today than young men. Joining us to talk about this is Gabriella Palmeri. She's Digital Health Innovator with Healthvana. And Gabriella, what we have seen over the last few years, or at least a decade, people talking about HIV in women, it's basically fallen off the map, and it's still a very big problem, especially when you look at African-American women. Why aren't people talking about it anymore?
You are right. Women are getting HIV, unfortunately, at skyrocketing rates. And women aren't being protected from HIV because we're not talking about it. And a big reason of why women are getting HIV at higher rates and we're not talking about it is because of these outdated views of who is at risk of getting HIV. It is no longer the HIV epidemic of the 80s. Today, the HIV epidemic looks a lot different. When I tell people this stat, it shocks people. So 1/5 of new HIV infections actually occur in women. And as you said, this unfortunately disproportionately affects women of color, specifically Black women. So of those 20% new HIV infections that happen in women, 50% of those are in Black women. And a lot of people don't know that we actually have really incredible preventative medication called PrEP. It's a daily pill. And if you take it as prescribed every day, it reduces your risk of getting HIV from sex by 99%. But this is wild. So the CDC says that only 10% of women that could benefit from taking PrEP are on PrEP. So there's a huge care gap there, and there's also a huge opportunity.
Now, is there a problem with affordability, or can you get it through your insurance if you need it for those women who are missing out?
Yeah, so actually under Obamacare, the Affordable Care Act, PrEP is covered under your insurance plans, and most states cover PrEP as well. So the medication itself is covered. There are some additional tests that may not be covered by your insurance, but the new funding bill, if it gets passed, will require that insurance providers cover those tests as well. There's also really great programs out there by the pharma companies that are in this space. There are really great teleprep companies where you can get PrEP over the mail that are kind of closing those gaps and making it affordable. I think the issue with women is people don't think of HIV as something that affects women. And what we need to do better, we need to educate women as patients about their risk. And we also need to educate providers so they will prescribe these preventative medications to women.
And of course, many people don't see it, as you said, as a disease or an illness that will impact women. And also in our minds psychologically with PrEP, and many people know about PrEP, it's out there. They think, well, it's not a big problem. All you have to do is take a pill now, right? Are we going down that path, down that road, because we believe the HIV problem has been solved?
Yeah, I mean, I think it depends on the person. I mean, if you're, if you're an MSN, a man who has sex with men, PrEP is being marketed to you. You're in all the ads. You see yourself represented. So it may not be a big deal to take a pill once a day as you're taking your supplements or brush your teeth or whatever else you may do. As a woman, as a female, that might thinking about your HIV risk and the stigma that comes with it, that might be a bigger hurdle that you need to overcome every day. And when you're taking that pill, actually at the end of 2025, there is a 6-month injectable coming out. So it's going to replace 180 days of taking pills with one injection done by a physician. And we believe that this is really going to be great for women because women and their providers will only need to think about their HIV risk, once every 6 months compared to every day.
And for those who are not getting the information, what do we need to do more in our our individual communities to make women aware of this? Is there anything we can do as individuals, or are we calling, or should we call on the government to make them more aware of some of the programs that are available and out there?
Yeah, well, I think the government definitely has a role to play, and to be fair, they are doing the best they can. They released a plan, actually under the former head of HIV for the White House, Harold Phillips, released a plan to end HIV by 2030, and there's funding behind that. But I think in terms of what can be done, it's conversations like this. It's letting folks know who is at risk for HIV, and that includes women. It's about talking to our friends. It's about educating providers and talking to our providers, letting them know that this is something that we may want and we may be interested in ourselves.
And welcome back to The Factor Uncensored. There are new groundbreaking ways technology is shaping the battle against HIV. Our next guest gives us details on a digital communication health platform that you can use. How important is technology and AI in this battle?
Yeah, I mean, we at Healthvana, we think it's incredibly important. We think AI is going to help improve access to care, educate patients, and reduce stigma in sexual health care. So at Healthvana, we're the largest technology company working to end HIV. We've helped over 500,000 patients in their sexual health care, and we're using those relationships now to inform our AI work, which is going to help educate patients. They can ask any questions, and when I say patients have been asking anything, they've been asking all sorts of questions. It's amazing to see what people are curious about in their sexual health care. And it's really a tool for people to use if they feel embarrassed about asking a question to their provider. So we think it's going to improve access. And I mean, this is an issue that can feel overwhelming, but in 2024, we have incredible technology like AI and incredible medications as well to help us in this fight.
That's great. Gabriella Palmeri with Healthvana, thank you for joining us here on The Factor Uncensored and what you're doing to alert women about this illness that's still out there and could impact them. We want to thank you for joining us tonight here on The Factor.
Awesome. Thank you for having me.